And when people grow old, at 60 to 70s, it is basically restoration. So whether it is for enhancement or maintenance or restoration, the main way of managing all the situation is by injection dermal filler. And when we say the dermal filler, we have both the natural and also the synthetic types. And what we prefer, most of us, whether Dr. Adit or Dr. Debraj or myself, we prefer the natural sources, that is basically the hyaluronic acid fillers. So being an ophthalmologist, I like to concentrate more on the periocular region, but also the structures which is near the eye, like the nose, a little bit of the lips if you want, and also we can touch a little bit of the eyebrows. So what are the periocular indication of dermal filler? It is number one, to bridge the hollows. And what are the hollows? The tear trough is a hollow, the sunken superior sulcus is a hollow, and the deflated eyebrow or the deflated orbit itself is a hollow. So the best way of rejuvenating all these hollows are by dermal fillers. And when I say the most common hollow that we see around the eye is the tear trough, and this tear trough is basically a separation of the orbital part of the orbicularis from the palpable part of the orbicularis. So you should know what is a true tear trough. When you look to the whole of the orbital part of the orbicularis, when we look to the whole anatomy of the orbicularis, it has got multiple parts, one is the palpable and one is the orbital. So when there's a split between these two parts, we call it the prominent tear trough. And then you need to separate this true tear trough from a false tear trough, where many people think this nasojugal fold, which is basically a fold between the whole of the orbicularis, that is the orbital part of the orbicularis, from the quadrate group of muscle, that is the levator labii superior elegantesi. So many people think that this is the tear trough. So you should try to differentiate between the two, and then accordingly you place your filler. Okay, so this injection dermal filler can do really wonders around the eye. First, definitely, as I have already mentioned, the correction of the tear trough. And secondly, in Indian scenario, we get the periocular hyperpigmentation, very common. Multiple reasons are to it, and one of the reasons being the shadowing. So this all not only corrects the tear trough, but also corrects the hyperpigmentation. Like this is a lady that you can see so much of hyperpigmentation with a prominent tear trough, and this we could overcome by giving an injection dermal filler. So this is a point which we call the cheek point, or the main point for the main modulus of injection. And then once you touch the main of the cheek point, you need to inject directly into the tear trough. This injection in the tear trough can be done with a needle or with a cannula, and I'll go into details in some of my later slides. So this is how we inject, but always remember that this tear trough region is not very simple. You have a very major blood vessels. You should be very careful so that you don't end up with any vascular complication. And this is how she looks after the procedure. And when you look her nicely, see, look the amount of the pigmentation and amount of the depression. And this is how immediately after the procedure, how she looks much prettier and much beautiful following the surgery. So tear trough number one, dermal filler number one, it corrects the tear trough, it corrects the pigmentation, and third thing, it conceals the fat pad, especially in the young people. Like if you look to the small fat pad, you can see there's a small fat pad here, and just after the procedure, you can see that the fat pad has much decreased. There's another lady with a very small prominent fat pad, along with a prominent tear trough. This is much being reduced after the surgical procedure. So what I usually prefer is that I use a cannula when doing the procedure, but there are ways where you can use a needle also to do the same procedure. So I usually mark the infraorbital rim. Another line I keep approximately 0.5 to 1 millimeter below, and I try to stay within this zone. So give a very small amount of microelucate, very small amount of injection, and it's always advisable to do a undercorrection than to do a overcorrection. So you go along the whole of the inferior orbital rim, and you try to fill it. You have to try to fill the tip of the cannula. Advantage, the tip of the cannula being blunt, so chances of vascular complication is much less. So these are the patients, you can see this is just a few, I think the day one. Can you see how beautifully the fat pad got concealed before and after the surgical procedure? So the results are so immediate. Like this is even you can see the entry point of the cannula, and this is a fat pad that got concealed after the procedure. So these are some of the patients that you will see before and after the dermal filler, where very beautifully you can correct the tear trough, you can correct the shadowing effect, and also you can correct the conceals the fat pen. Here I would like to show how to do an injection with a needle. So in the same way you mark the infraorbital rim, and then the most important, when you do a needle injection you have to aspirate, and the time of aspiration follows varies from 8 seconds to 39 seconds, but I usually wait for approximately 12 seconds before I inject the dermal filler. So very slow amount, you can see a very slow amount needs to be injected, and you will see the results immediately on the table. Like this is how you mark the infraorbital rim, and this is how I'm marking where the anatomical landmark of the infraorbital blood vessel. This is a main C point that we say. This is a point where all the ligaments get attached to it, where many of the plastic surgeons calls it the G point. And then you mark in the 3 major points, like centrally you can give 0.2, then medially 0.1 and laterally 0.2. It is not necessary that you follow what is the textbook says, but you should follow what the patient wants. Always do an undercorrection. You should customize the amount of feeling. And the lady, you can see the right side is being injected. Sorry, my voice is totally gone. And you'll see on the table, you'll see the changes. See, this is the right side that is injected. The fat bag is not there. The left side needs to be injected, and you can see the fat bag is much prominent. So the results are very immediate, and you'll see a definitely change. And the patient looks much rejuvenated following the procedure. And not only that, the correction of this negative vector into a positive vector following the injection procedure. Another indication of dermal filler is a correction of the A-frame deformity. What is this A-frame deformity we see in the eyelid? It is a prominent superior sulcus. That is, the superior sulcus becomes much sunken. So I feel the best way of managing this is with dermal filler. There are different routes to it. Many people go for pre-periosteal. I like to go pre-septal because the space is more and the vessels are much less. So chances of vascular complication is much less. This is what you see, how slowly I am injecting, and you don't go for a very high concentration dermal filler, and you really need to massage very well when you do the procedure. And this is a patient, she looks immediately on the table. This is, see how the superior sulcus, and this is after the procedure, and this is how she looks before and after the procedure, and this is the beauty. You can see the whole of the superior sulcus, and it looks so good tissue. If you don't mind, don't take much of these videos and the patient's picture. And you can see so beautiful correction of the superior sulcus. So this, and I would like to show one lady. You can see this A-frame deformity, which is very, very common, and this should not be ignored, because this is something very important which needs to be done. It needs to be treated when a patient comes to you for a cosmetic rejuvenation. And being ophthalmologists, it becomes much easier for us. And a very simple way is a pre-septal, which is very safe, but you need to mold the product very well. You wait for some time, give a very nice massage, and this is a very, what is not a very concentrated hyaluronic acid, so it can be molded very well. And this is how she changes on the table. This is just before the dermal filler injection. This is the next picture you are seeing. This is just after the injection, and then you see the beautiful result. This is approximately a week after the injection procedure. So you can see the whole of the superior sulcus gone, camouflage with a dermal filler. So these are some of the pre and the post-operative patient. This is how she looks, and this is after the injection of the dermal filler. So many times what happened when we all started with the blepharoplasty procedures, we were very aggressive. What Dr. Debraj has already mentioned, we try to excise as much of fat as possible, and we let the patient, young girl with so much of sagginess of the skin, you can see so much of loss of tissue. This has been done because of the excessive removal of the fat during the procedure. So how do you correct this type of problem? This can be also corrected by augmenting the same region with a dermal filler. And this is how you can see the same lady, where I had only done the blepharoplasty when I was, many years back, and I landed with so much of, tissue loss, and this you can done augmentation with a dermal filler. the same cannula is being used, and now you can see the change before and after the procedure. And when the patient animates, you see the skin looks much better following the procedure. Other periocular indication can be many patients, they are reluctant to take botulinum toxin type A because they feel that it's a toxin. So it works very good for the crow's feet, and you can usually go just above the orbicularis muscle and inject the product. And this is a patient where the scar has been revised following the injection of the dermal filler. My voice is gone. A brow lift is also a procedure where you can use the dermal filler, especially in those type of deflated brow. It can be done with needle and it can be done with a cannula. I prefer a cannula because I feel that her cannula is safer, and this, she's so young, but she has got so much of deflation around the eyebrow region, and being a very prominent personality, so I've used a cannula to correct this deflated eyebrow. And then this is how she came, and this is on the table. You can see even the shape looks so beautiful following the dermal procedure. This is something challenging that I like to show. Sometimes patient comes to you with anophthalmia. So these are very difficult cases because these patients, they want some amount of correction of anophthalmia, and this is a pure functional indication of dermal filler. But please don't try as a beginner, because she has got 6/6 vision and she wants a non-surgical way of correcting her anophthalmia. So what I have done, I have used a dermal filler, but mind you, I am using a cannula. Just give a first entry with a bigger size needle, aspirate very well, and when you inject, you have to monitor the pupil. Do I still have time? The brush? And then you can see I'm monitoring the pupil in every step. This is, look to the right, this is just after the procedure, and you can see the correction of enophthalmos. This is post-operatively, and I've been following her for more than 3 years now, and she is not requiring any further augmentation. This is how she came to us, and we looked to her superior sulcus deformity, and it is much better following the injection dermal filler. But this should be done as a very advanced procedure, and please not for the beginner. So before I'd like to mention a very important point, that is a CK1 point. This is a cheek point which is very important because on this point, all the main ligaments are being attached, whether it is zygomatic ligament or orbitomallear ligament, or you have the STL. So these are the main ligaments which are all attached to this point, and this is a G point where you need to touch this G point, and which with a small single touch, it can correct so many things. It can correct your tear trough, it can also lift your eyebrow, and also it can correct the nasolabial fold. Like these are some of the patients where only a mid-face filler has been done, mainly concentrating on the CK points, and you can see without touching the other point, you can see a very beautiful correction, a very good lifting of the face or the ovalization of the face. And as Deborah has already mentioned about the liquid rhinoplasty, this has become a very common indication, especially those patients who have a deformed nose because of trauma, or as a cosmetic indication, and a very good way of lifting the tip, which Deborah has already shown so beautifully. So with this, I'd like to mention that always remember that dermal filler are not medicine. Like in medicine, we like antibiotic, 500 milligram 3 times per day, we can say. But in dermal filler, we don't know whether what is the amount of volume. It depends upon your experience, so you need to customize. So the main complication may be the volume is too much, or it can be too less. The depth can be too superficial or too less. Like this is one of my patient initial days where you can see you can see the lumps out there. But I have given hyaluronidase and immediately it got corrected. So these are some of the complications, but one major complication is a vascular complication. So you should be very careful. But one thing we are very lucky, because we have both the true anastomosis and the choke anastomosis on the face. So if the product enters into choke anastomosis, then it leads to localized vascular complication. But if it enters into the true blood vessel, then definitely you might end up with a vascular complication. So please aspirate before you do such procedures. So you should have a filler crash kit, the most important being the steroids and hyaluronidase, etc. And you should, if you have any complication, immediately you go for injection hyaluronidase. Like this lady, she had developed a nodule during the COVID era. At least she had developed 6 months after the dermal filler. When I injected her hyaluronidase, this has all that led her to some reaction, but now she is much better. So you may have multiple complications, but you should be having all your armamentarium ready with you, so that even there is complication, you should be able to manage it. With this, I conclude. Thank you very much for having me with you all.